Hi mamas, Carla Rose here, pre and postnatal specialist. Today I want to talk to you about low back pain. Low back pain is really common during pregnancy, and I get a lot of complaints about it. So firstly, why could you be experiencing low back pain? You can be experiencing low back pain because your stomach is coming out like this here on 25 weeks pregnant, and it's pulling your pelvis or your hips forward, causing a lot of compression and tightness in your lower back. You can also experience a lot of low back pain is because you've got an extra weight pushing down onto your pelvis. This is causing an uneven distribution of weight onto your body. Your pelvis is moving constantly. You've got a lot of hormones flooding your system, especially the hormone relaxin that helps a lot during pregnancy, but it can also cause that pelvis to move and create a lot of imbalance in your pelvis, which is holding you up, which is why you experience the pregnancy wobble. So there are so many ways that you can help low back pain, reduce the pain and discomfort that you're feeling during pregnancy. The first thing you got to do though is identify where the problem is coming from. I see so many videos nowadays that just say, pregnancy, low back pain, do these stretches. What you want to do is you want to identify where the problem is coming from and then attack that problem with a great solution that can help really alleviate the pain around that area. So firstly, where could the pain be coming from? If you're experiencing a lot of tight hips and low back pain during pregnancy, it could mean that your main issue is your core. So you have a weak core that is not supporting your hips and your lower back, your spine properly. And there are so many core exercises that you can do during pregnancy that can help strengthen your core. So many women stay away and they try and steer away from working their core during pregnancy, which is totally incorrect. Yes, you should not be doing ab crunching exercises, twisting of the torso when you're pregnant, but there are many other ways that you can strengthen your core and work on your deep integrated core muscles, pelvic floor during pregnancy. Another area that the pain can be coming from is a weak glute medius. The glute medius is the most underutilized muscle, I personally think, in the body. So a lot of us work the glute maximus, so your big butt muscle, but we forget about the tiny glute medius that does a lot of support in your system. So if you look at your back, you've got two bones that sit at the back here that are sticking out. So you can probably put your two thumbs on your back and you'll feel those bones sticking out there as you put a bit of pressure. If you feel a lot of pain coming from the outside of those bones, this probably means that you've got a weak glute medius. And there are so many ways that we can help strengthen this glute medius, and I'm going to show you how. So the first exercise we're going to do is we're going to attack the glute medius. So I want you to come onto the ground. I want you to post your elbow down onto the floor, making sure your shoulder is nicely aligned. You're going to bring your thumb and place it onto your lower back into the area where you can feel the pain. Okay, so you can usually feel that sharp pain, and it's really good using your thumb because you get to apply some top-down pressure, and you can control how much pressure you apply. Your top leg is going to come up. You're going to bring your knee down and tap it down to the ground, and then you're going to kick it up, making sure as you kick it up that your toe is slightly pointing towards the ground because you want to get that hip abduction. Then you're going to lift your leg even further, and immediately I can feel that working my glute medius straight away. Okay, so the knee is going to come down, touch down, lift up, so kick back up. Then I'm going to try and lift it up even further. I can already feel it working. Lift it even further. Tap down, push up, lift it up. And it's quite hard. This is a hard exercise, yeah? Lift up, but I'm strengthening that glute medius and I'm applying pressure onto the position in my back that needs to have that pressure release. So I'm releasing a lot of tension from that. And release. The second exercise we're going to do to strengthen that is we're going to lift, kick up, lift our leg up and hold it there. So that position that you're finding a little bit difficult a few moments ago, you're going to do that again, but you're going to hold it for as long as you can. Nothing comes easy, guys. You got to put in a bit of work. So popping your thumb onto the area where you found the pain, just applying as much pressure as you can. Bring your leg down, kick it up. Now lift it up to as much as you can and hold it. You want to hold that for about 10 or 20 seconds, for as long as you can manage, and release it back down when you're done. Your next exercise is going to be the side plank. So coming down again onto your elbow onto the floor, making sure your shoulder is nicely aligned. You can do this side plank with your legs fully extended, so bringing yourself up here, tighten that core. So what you want to do is inhale, belly comes out, exhale, support your pelvic floor, support your core, and lift up. And you can hold it there as long as you like. If this is too difficult for you, you can always bend your legs, and that's totally fine as well. So inhale, exhale, pulling your pelvic floor under, supporting yourself, giving a hug to that baby, lifting up. And you can hold this one for 30 to 40 seconds, doing a couple of rounds on each side. It's really important that you strengthen your core throughout pregnancy, and the side plank is a great way to do that. If you want to make it more challenging whilst you're in your side plank with your legs fully extended, you can also lift your top leg slightly up and down, but only do that if you're an intermediate or advanced level. Your third exercise is working on your glute medius as well. So what I want you to do is your hand closest to the wall, you post up against the wall, and this is to help you support you, especially when you've got a bigger bump and your balance might be off. You're going to lift up the leg closest to the wall, and then you're going to allow, lifting up that leg closest to the wall is going to make that hip drop, and you see how my hip dropped out. So leg comes up, my hip automatically drops. What I'm going to do is I'm going to squeeze that glute and lift up so I can push that leg as much as I can into the wall and back down. Squeeze up, push the leg into the wall, and then allow my hip to drop. So squeezing that is squeezing the glute medius. I'm contracting as much as possible, pushing into the wall, pulling back down. You want to do about 10 to 15 reps here. Back down. And you want to do that a couple of times a week. That's going to really strengthen that little glute medius muscle here, and it's going to help alleviate that low back pain. So there you have it, guys. Really easy exercises that you can do at home to help alleviate low back pain. Don't suffer in silence. There's so many ways you can tackle the problem. Identify, find a solution, do the work. See you next time. If you enjoyed this video, please like, subscribe, and comment so I know that the content is bang on.